What if someone that you love collapsed from a sudden stroke and you discovered that they've had an undiagnosed heart condition for years? Well, this is the reality for 1.4 million Americans with an undetected cardiac arrhythmia, an irregular heart rhythm that often goes unnoticed until it's too late.
Over 60 million Americans are affected by cardiovascular disease. Current diagnostics like Holter monitors, implantable loop recorders, and long clinic visits are invasive, expensive, and inconvenient, costing over $2,000 for short-term monitoring and over $10,000 per patient for implantable devices. Cardiovascular disease remains the leading cause of death globally. Early detection and preventive care are not accessible to most people.
This is why we created CardioBound, a multi-sensor edge AI wearable that detects arrhythmias in real time and stratifies risk. We will first launch our software as a diagnostic layer for existing wearables, giving clinical insights before the hardware release. The hardware integrates a microprocessor suite, artificial intelligence models, and a mobile application to deliver clinical-grade detection.
CardioBound's hardware includes ECG, PPG, IMU, and temperature sensors. The ECG captures precise heart activity. The PPG measures blood volume changes, the IMU tracks motion, and the temperature sensor assesses physiological stress linked to cardiac events. Data is pre-processed on a custom-printed circuit board with an NVIDIA Jensen Nano and a Raspberry Pi ESP32. We use a hybrid convolutional neural network and a long short-term memory model for arrhythmia detection.
An XGBoost model predicts the probability of future cardiovascular complications using clinical records. Signal processing includes bandpass filtering, R-peak detection, heart rate variability, feature extraction, and motion artifact removal. The mobile application visualizes results in under 5 seconds with a 97.5% accuracy and provides clear, actionable insights.
Unlike iRhythm's ZeoPatch, Medtronic's Link, or Philips MCT patch, CardioBound is affordable, comfortable, and continuous. Artificial intelligence optimizes detection for long-term monitoring and early intervention.
Our focus is 60 million Americans affected by cardiovascular disease, especially adults 55 and older and underserved communities. Partners include Mount Sinai Health System for pilot studies, cardiologist Dr. James Ronaldson and Dr. Audrey Spredikis as clinical advisors, and local community health centers for early deployment. Integration with insurance providers and telemedicine platforms ensures scalable preventive care.
CardioBound's Edge AI hardware will be patented and priced between $120 wholesale for clinics and $199 retail for direct consumers. Subscription plans cost $20 per monitored patient per month. In year one, we project to have 5,000 wholesale device deployments and 1,000 direct-to-consumer sales.
As patients use CardioBound over several months, clinicians observe cardiac trends earlier and intervene before acute events occur. We will pursue an FDA 510(k) clearance to verify medical safety, diagnostic accuracy, and reliability in clinical environments.
We will start with software diagnostics for existing wearables such as the Apple Watch, and then launch hardware through pilot programs. Insurance partnerships will cover preventative monitoring, reducing late-stage cardiac event costs, and improving patient outcomes. In the first year, we expect 6,000 total device deployments.
In the following years, we will continue to expand into additional clinics and remote monitoring programs while refining CardioBound's predictive algorithms and embedded hardware so that continuous cardiac screening becomes routine across broader patient populations nationwide.
Good morning. My name is Dr. James Ronaldson. I'm a board-certified cardiologist working in Melbourne, Florida. I've been asked to say a few words about ambulatory monitoring. It's an incredibly important part of our work. I've put in pacemakers for 25 years and also treated atrial fibrillation. Being able to monitor someone in an outpatient setting in an efficient, low-cost manner, even with the help of AI, would be extremely helpful, because if they have irregular heart rates, they could have the potential to have strokes, and if we could find out about this earlier, that would be a tremendous benefit.
Consultations with cardiologists confirm the urgent need for early and accessible detection and risk stratification. With CardioBound, families can rest easier, knowing that their loved ones are monitored continuously. Thank you, and guard your rhythm.